Okay, so this mini lecture is regarding physical develop in middle adulthood. So one of the big things that we've talked about is these transitions, how they are kind of blurred, not only by one's individual development, but also by their perception. And middle adulthood is no exception to that. So what's funny is even as they're older, their identity is still linked into their younger chronological age. You see a lot of the population changing in demographics, that you're seeing more middle-aged people than you are the younger people. Also, when you look at the age span, you're talking anywhere from 40 to 65 years of age. There's a lot of physical changes that are happening, sadly, declining. So we've been talking up until this point about all of this growth, and now we're starting the backslide of that hill. So they have less, or they're having gradual declines in their physical abilities, but also increasing responsibility in their lives. They are very aware of this whole young-old polarity. They are very concerned with transmitting something meaningful, developing generativity, as Erickson would say, to the next generation. A lot of career satisfaction because they paid their dues at this point. So when we are looking at biological and social cultural things that we look at, these are some of the big life events that often happen during late midlife: death of a parent, kids leaving home, the last child leaving the home, becoming a grandparent, and preparation for and retirement. So when we look at physical development, there's a lot of visible sides. So the skin begins to wrinkle and sag due to loss of collagen, age spots appear, hair starts to thin and gray, nails are thickening and becoming more rigid and brittle, teeth are yellowing. So yeah, just a lot of great things happening, right? You often see a difference in weight. They often lose bone mass and gain weight. And as we've been talking about throughout the stages, being overweight is a big problem, and it only exacerbates a lot of the physical changes that I'm going to talk about in the next few slides. So these are a couple different conditions that they notice. Progressive bone loss that will often lead to osteoporosis. There's a lot less cushioning in the joints that makes bone movement less efficient. There's a lot of changes in sensory development too. The eyes become less like the lens, and the pupils become less elastic, just like the skin. So you'll see a difference in the way that people see. They sometimes need glasses in middle adulthood because they have issues with seeing things close up. Cataracts and presbyopia, all sorts of not fun things. So those are some of the, sensory issues that you see. When it comes to the cardiovascular system, this is where the issues with obesity become even more problematic, because some of the things that you already see are higher blood pressure or higher cholesterol levels. All of these are linked to weight gain between the ages of 45 and 60. Unhealthy diet in adolescence, as I said, we talked about it in primary versus secondary aging. It's also linked to social economic status, which we've also talked about, the whole what kind of food can you afford, that sort of thing. So big things that adults can do to help preserve their cardiovascular system are exercise, weight control, and a healthy diet. Lungs also become less elastic, so you're seeing this common theme here, less elasticity around the ages of 55, so you're not seeing the same kind of lung capacity. Sleep is also an issue. You see people sleeping differently, not sleeping as much, or having difficulty sleeping as early as the 40s. All of this is linked to immune system functioning as well. When we look at the different chronic disorders, they're often low onset, long duration. They're rare in early adulthood, but you see a lot more of them in middle age. Also, this whole idea of stress and control is a big thing. Control has a lot to do with their perceived ability and their health and their stress levels. So you'll see a huge, and we talk about it in the social piece of this age span too. And when you look at the different reasons why people are dying in middle adulthood, a lot of times it's a chronic disease, heart disease, and cancer, for example.